All right, good afternoon, everyone. Thank you all so much for taking the time to spend this hour with us for our Caregivers Count webinar, Policy Solutions and Community Resources to Support our Family Caregivers. My name is Melissa Williams, and I am the Associate Director for Policy and Field Advocacy here at National Patient Advocate Foundation. And before we get started, just to go over a couple housekeeping items, we ask if you could please mute your lines, especially as you come in. And if you do have questions, we will have a question and answer session towards the end of our presentations. But we ask if you could just please just enter your questions into the chat so that we can cover that as we go on with the presentation. And if you're in a position where you can turn on your cameras, we'd love to see your faces and sort of get your reactions to what we're talking about. So if you feel comfortable, we invite you to turn your cameras on. And we just want to thank our sponsors first and foremost for making this campaign that we are launching this month for the first time, Caregivers Count, possible. So just a huge thank you to Johnson & Johnson, Bristol Myers Squibb, Grail, and Takeda. And before we get started, I just also just want to give a little background about what Caregivers Count is. I know some of you are joining us for the first time, might not be familiar with National Patient Advocate Foundation, and just want to give some background to let you know that Caregivers Count is, this is the first time we're doing this campaign, and it's a grassroots awareness campaign that we're leading. And you might be wondering, well, what are we really trying to bring awareness to here? What we want to bring awareness to are to the resources available that will help caregivers feel more equipped and confident in their roles. And so one of the ways that we're doing that is with this webinar today. We have invited some of our partners to join us, and I will introduce them momentarily, but we are going to go over just ways for you all to learn more about the innovative and engaging work that is being done currently to support caregivers. Describe at least 3 actions that you all as patient advocates can do to support caregivers, whether it's someone you know, whether it's a caregiver, whether you're a caregiver, or if it's just more broadly of supporting caregivers in your community. And also going back to those sharing resources, identifying those caregiving resources that you can share. And so I will be turning it over to, I will be turning it over to our presenters here shortly, but I just want to thank them all for taking the time to be here today to share a little bit about themselves and the work that they're doing in their respective organizations. So at this time, I'm going to turn it over to Chance Browning, who is the Senior Director of Programs with the Caregiver Action Network. So Chance, I will stop sharing my screen and the floor is yours.
Fantastic, thanks Melissa. Let me get my screen shared. And how's that? Can everyone see it? Fantastic. Yes. As Melissa said, my name is Chance Browning. I am the Senior Director of Programs here at Caregiver Action Network. We are the leading family caregiver organization. We represent the 90 million family caregivers across the country that really, when we talk about that 90 million number, we're really talking about caregivers across the full spectrum of care, those who may be caring for an aging parent, those who may be caring for a child with significant health needs, and really every scenario in between. So that's sort of who we are. The way we do our work is by providing resources, tools, and trainings for those family caregivers. We understand that when a caregiver feels better prepared and supported in their role, then they're a little less stressed. So one of the ways we do that is by providing Caregiver Help Desk as a resource for family caregivers out there. This is a on-demand free resource for those family caregivers to reach out. It's the 800 number you see on your screen. It's also a chat function within our website. And so, we receive calls and chats, and even after hours, there is sort of an email function to all of that. You see the hours at the bottom of your screen, 8 a.m. to 7 p.m. Eastern Time. As I said, after hours, there's sort of an email function, and then you can get a follow-up call. This really is designed to meet family caregivers where they are, understand the challenges they may be facing, and get them connected with resources and tools that they may not know about, or help them identify something that may be available in their community, whether that's rural or whether that's in big metro areas. To date, since we launched Caregiver Help Desk in the fall of 2019, we've fielded over 10,000 inquiries from family caregivers, and you see below sort of the range of issues that folks call in to connect with our caregiving experts about. Anything from just wanting to talk and connect with someone who understands their circumstances, to looking for those resources and services, financial support, support groups, et cetera. Obviously, in the last year, we've fielded a lot of questions connected to COVID-19, as you might imagine. In terms of a little bit more about what we do here at CAN, one of the concepts that we're really committed to within our educational resources is the idea of shared decision making. So we integrate that into a whole host of tools and webinars and resources that are available on our website, caregiveraction.org. It really is the idea of marrying goals and research to getting to that shared decision. You see here sort of a basic concept of what that looks like, educating the general public and family caregivers about the tools and resources available, talking to them about how to identify desired outcomes, talking about how to effectively research those options, and then putting it all together in that shared decision between the person that you're caring for and you, the family caregiver. The one other thing that I will mention that we are working on right now is an effort that we're calling Caregiver and. One of the things that we hear so often is, the identity of a family caregiver is consuming to you as an individual. And you often feel like parts of your life that you are passionate about and that enrich your life sort of takes the back seat as a family caregiver. And so Caregiver and really is an effort to acknowledge that, to recognize that, and to get folks connected to some of those self-care resources that are available to them. So this is what we would consider a visual campaign, but we're asking for folks to participate and join that effort as well. But when we're talking about these identities, we're talking about those family relationships, moms, dads, uncles. That's a huge part of your identity, but you're likely consumed by the person that you're caring for. We don't want to rule out our pet families as well. So, the purpose of these efforts really is to make caregivers across the country feel seen and recognized. And that goes from everything from the family relationships, like we were just talking about, to your involvement in the community. Your job and your career is a big part of your life, even in retirement. Entrepreneurs. The point of this campaign really is to underscore that family caregivers are in every walk of life, in every scenario, in every intersection. We're not just talking about family members, we're talking about here, as you see, teammates, friends, those who are helping care for each other. and we don't want to forget our hobbies and our other outside interests. You see a foodie here. I know I'm a foodie, so that's an important part that can, in understanding and recognizing that and taking the time to celebrate that really does put into perspective, that self-care component that we want to focus on with this effort. And like I said, self-care really is the through line with this campaign in particular. We also want to leave it open for other folks to see themselves in their scenarios within this campaign as well. The last thing I'll leave you with is just sort of some basic info about Caregiver Action Network. Like I said, whether you connect with us via our website, caregiveraction.org, there's a whole host of tools within our toolbox online, whether you connect with us via Caregiver Help Desk, which is the 800 number you see on the screen, or via social media. We're constantly rolling out practical tools and resources for you to sort of help alleviate some of that stress that comes with your caregiving scenario. So with that, I'll give back a couple of minutes of my time, but thank you. Well, let me stop sharing.
Thank you, Chance. And I just want to remind everyone, if you do have questions, as you hear these different presenters, you're welcome to enter it to the chat, and we'll go over those questions towards the end of the presentations. At this time, I'm going to turn it over to Karen Marshall, who is the Director of Advocacy and Engagement at the National Alliance for Caregiving, and she'll share a little bit more about what they do there and some of the policy focus that they've been working on to support family caregivers. Karen? Let's see, I think you're on mute. There you are. Let's see. Oh, Karen, I think we're still having issues hearing you.
Can you hear me now?
Yes, we
Okay,
can.
great. All right. I managed to unmute my Zoom and somehow mute my headset. So apologies for that. Thank you, Melissa. Hello, everyone, and thank you to National Patient Advocate Foundation for hosting this event, and for all of you who are on the line today to recognize the vital role of caregiving in our country. As mentioned, I'm Karen Marshall, and I'm the Director of Advocacy and Engagement at the National Alliance for Caregiving. I'm also a former family caregiver. Once upon a time, I was a young lawyer, fresh out of law school, embarking on a career as a government affairs attorney. But that I often say that career detoured so that I could become a family caregiver. But at this point, caregiving has been such a focal point of my professional and personal lives that it's probably more accurate to say that my initial career at a big law firm was the detour for my caregiving life. That's because I was among the 6 in 10 employed caregivers who worked full-time while also providing care. And I was among the 61% of caregivers who experienced at least one impact to their ability to work, such as taking time off for caregiving, moving from full-time to part-time status, or taking a leave of absence. I've done all of the above at some point in my life. The first is when I took a leave of absence to help my father care for my mother. We were her primary caregivers before she died of stomach cancer. And my dad was self-employed, and he had always been in great health with no chronic illness. And while we were caring for my mother, I didn't think of myself as a caregiver. My father didn't think of himself as a caregiver. We were daughter and husband. We were a family. However, caregiving had adverse impacts on my dad's ability to run his business and on his own health. And shortly after my dad died, when my mom died, my dad became quite ill, and I became his caregiver and made the choice to leave my career for a while. Before my dad died, I established a community-based organization that provided education and support programs for family caregivers. And I spent a lot of time trying to explain to people that they were caregivers and that their role, in addition to being a daughter, a son, a spouse, a parent, a neighbor, was even though it wasn't formally recognized within the healthcare system, they did play a vital role in how healthcare is delivered in this country, not only to their own loved ones, but and to the system in general. So now I work with National Alliance of Caregiving for Caregiving with our grassroots advocacy network of state and local coalitions, and you'll hear from one of the members of our advocacy collaborative shortly. Pardon me. So what we do at the National Alliance for Caregiving, pardon me, and we work to create a society that values and supports and empowers family caregivers to thrive at home, at work, and in life. We build partnerships in research and advocacy and innovation to help make life better for family caregivers. You may have seen some of our research. We compile nationally representative data on the caregiving experience about every 5 years. That name of that report that we publish with AARP's Public Policy Institute is Caregiving in the U.S. We also research and publish several deep dive reports into the experiences of specific caregiving populations, from Alzheimer's to rare disease to working caregivers. These reports take a closer look at the challenges that face caregivers across the lifespan. We also publish several guidebooks that are intended to help improve the caregiving experience, such as our Mental Health Circle of Care Guidebook and our recent Circle of Care Guidebook for caregivers of children and adolescents who are managing Crohn's disease. These reports not only highlight the experiences of caregivers, but they also inform dialogue about the policies that impact them and their families. So I definitely encourage you to go to our website. It's pictured. It's listed there at the bottom of the slide, caregiving.org. Go to our research tab and take a look at what we have available. And if you see a report that is related to your caregiving situation, I invite you to take a look through it and see what types of policy recommendations are made to help make life easier for yourself and for other caregivers in your community. Different policies that can help influence what lawmakers are doing to help make their lives better, both in your communities and nationally. A primary, at the core of a lot of our work is family caregiving status is a public health issue. There are 53 million family caregivers in the US, and the estimated value of the care they provide is over $470 billion. As a society, we rely on caregivers as providers, not just within our families, but even emerging trends in managed care and long-term service and support organizations have come to rely on paid caregivers to fill gaps in care. The presence of a caregiver can result in better health for older Americans and people with chronic conditions and living with disabilities, better outcomes for families, and even lower costs. There's research that supports that the presence of a family caregiver can help avoid hospital readmissions. And even government recognizes that caregivers can reduce costs. A couple of years ago, a little more than a couple of years ago, Congress passed the Raise Family Caregivers Act. The Recognize, Assist, Include, Support, and Engage Family Caregivers Act. That's what RAISE stands for. And it created a federal advisory council to discuss caregiving issues across the lifespan and ultimately develop a caregiving strategy. That council is releasing its initial recommendations to Congress later this summer, and then we'll begin work on a national strategy that will call upon all sectors of society, public and private, to see what they can do to help implement changes to improve the lives of caregivers. In recent years, there have been budget increases to programs that fund respite care, which allow caregivers to take breaks and for their own personal rejuvenation, and also to handle other responsibilities. Respite allows them the opportunity to be able to have a have someone continue and provide care while these caregivers are taking their breaks. The National Family Caregiver Support Program, which is funded under the Older Americans Act. If you are a loved one receives Meals on Wheels, for instance, that's a program that's funded by the Older Americans Act, as well as funding for Alzheimer's and dementia care and support and research. In addition, most states at this point have passed the Care, Advise, Record, and Enable Care Act, which provides for the identification of a caregiver at hospital discharge. Again, the rationale being that the presence of a caregiver can help avoid readmissions and help assist with continuity of care when people move from formal healthcare settings like hospitals to go back home. Yet, navigating all of these services and supports is difficult for caregivers because services and supports are siloed. Here you see in this diagram, without getting too academic this afternoon, you can see different buckets of ways that caregivers access services and supports, and they're usually through the caregiver, through the beneficiary, and their services for the caregiver as a beneficiary, and their access by virtue of the person that they're caring for being eligible for a particular program, as opposed to services that are independently available to caregivers out and do not need to be accessed through the person that they are caring for as a beneficiary to the program. And this complexity of navigating services and supports is actually depicted here in this infographic from our most recent Caregiving in the U.S. report. A notable trend from our most recent data, which was collected in 2019, compared to our earlier report from 2015, is that not only has the prevalence of caregiving increased, there were more caregivers in 2019 than there were in 2015. I say 2019 because the data was actually collected in 2019. It was reported in 2020. But we also see upward trends in challenges related to caregiving. Caregivers report that coordinating care has become more difficult. Finding affordable care has become more difficult. They're experiencing greater financial strain. They're experiencing poorer health outcomes. 23% of Americans say caregiving has made their health worse. And for these reasons, our work focuses around some core advocacy principles that work to expand the caregivers' access to services and support, and invest in evidence-informed caregiver research. It's much easier for us as advocates to advocate for a policy if we can show evidence that services and supports lower healthcare costs or improve health outcomes. Protecting the financial security of caregivers, things like paid leave for family caregivers so that they can take time off from work to be there for their families when they need them, as well as tax credits for caregivers, which would help even caregivers who aren't necessarily even in the workplace offset some of their out-of-pocket costs, which can be estimated an average of $7,000 per year, as well as work to include caregivers as vital members of the health and human services system, such as the CARE Act that I mentioned earlier that's so helpful at discharge. And finally, measures to enhance the health and wellness of caregivers. Agencies like CDC are increasingly focused on efforts to address caregivers as an at-risk population, aside from the people that they're providing care for. So again, I encourage you to go to our website and check out some of those reports if there's a specific caregiving population that you identify with, and take a look at some of the policy recommendations that we recommend for those issues, so that you can help engage with your local and federal policymakers. Thank you.
Thank you so much, Karen. We appreciate you providing that feedback, or not feedback, but that overview about what you do at National Alliance for Caregiving, and for also sharing your own personal caregiving story and kind of what led you to this important work. So thank you. I think some questions came in as Karen was presenting, and we'll go over that just after we have our next presenter, and that is Miss Janice Williams, who is the CEO and founder of Caregivers Respite, an organization based in Memphis, Tennessee. And Janice is also a volunteer for National Patient Advocate Foundation. And so Janice, I'll turn it over to you. I know you aren't sharing slides, but I think just share what you would like about the work, the important work that you're doing, and kind of what led you to find Caregivers Respite.
Thank you. Well, my name is Janice Williams, and I'm really excited about today because I get to share my story with you. Actually, my dad got ill and he went through so many levels of care, like overnight. And even though I was a nurse and actually had been a nurse for, I think about 12, maybe 14 years, and nothing prepared us to take care of him. I mean, we never had conversations. And actually, my dad, he was very self-sufficient. He took himself to the doctor. He would cook his own meals. He would buy his own toiletries. I mean, he was on it. In fact, so much so, he would get on me sometimes about what I didn't do. And so my dad was on it. And when he got ill, it really threw our family for a loop. And you know what? Actually, as I think about it, I don't know what I was thinking. I guess I thought he would live forever, you know? And as I went on this journey of caring for him, a lot of people might think their parents are going to live forever. And I'm just here to tell you that they're not. And it was a real wake-up call, transitioning from nurse to caregiver. And it was actually so painful. I remember it like yesterday, but it was painful, but yet it was good because I learned so many things about myself. I learned a lot about my dad. Him being so self-sufficient, he really didn't share a lot with us. But when he was ill, he was very vulnerable. And I got to know him in such a different way that it really blessed my life. And, you know, in the middle of that, you have bills and you have a life, and you're feeling inadequate sometimes. And hey, that's the caregiving journey. But I will tell you one thing, I would not have traded it for anything, because it was a difficult time, but it was such a blessing to my life. So much so when my dad passed, really God let me know to start Caregivers Respite, and that's what I did. And I really didn't know what to do. I just knew I had to do something. And Caregivers Respite, we're a nonprofit that supports family caregivers. And when I say that, I want to clarify. So we don't financially support family caregivers, but we try to support every gap that we see that they need. And it's so important. We're a grassroots. In fact, that's what we do. We touch people. In fact, I've really been on just a mini vacation, but actually 3 caregivers called me today needing some help. And so I just want you to know that if you're a family caregiver, your job is huge, but it is a blessing. And if you're an advocate, let me just tell you, your job is huge, but it is really going to strengthen your life, add to your life. And so I want to just talk a few minutes to our advocates that are on the line on this webinar. Advocacy is very near and dear to my heart because actually in starting Caregivers Respite, that exactly is what I was doing, and really didn't take the title of advocate. But if you're a family caregiver, there is a lot of strategy you have to use, but there's also things that you have to stand up for, that you have to fight for, but you cannot do any of that unless you understand the system. So one thing in Caregivers Respite, we do a support group every month. We do an annual day of rest for family caregivers, and we do other campaigns in the middle of it. As Miss Marshall, she's so awesome. She just mentioned the statistics. And as advocates, we need to know the statistics because family caregivers are everywhere. I mean, they're in our churches, they're down our streets, they're on our jobs. In fact, you need to know the stats so you can make a difference when you talk to somebody. We all face, all three of us, Mr. Browning, Miss Marshall, we face the opposition of people not really understanding of who they are. And one thing that I have used and will continue to use are those statistics, which is so powerful. The statistics, and Miss Marshall, and as she invited you to her site, please go, because when you see the new stats, and this was pre-COVID, I know actually we started Caregivers Respite in 2010. But so I was looking at stats for a long time. So I think when we started, there were, what was it, 44 million family caregivers, but now there are 53 million, and that was post-COVID. And so knowing the statistics and what people are actually facing day to day is really gonna help. I do want every advocate on the line to know this. What you do for someone, you may not start an organization, you may not be on TV, you may not get a thank you, but what you do for someone is huge. In 2010, we started, I didn't know what we were doing, but we were doing it. And even people come up to me today saying, oh, Janice, you all helped me, and I don't know what we did. So stats are good, but our stats mostly come from people that I will see again and that may say, oh, Janice, you helped us. And that is huge because, as Miss Marshall just said, you're dealing with a person's finances, you're dealing with their physical health, their mental health, right? And so, and family caregiving really can be devastating to every part of your life if you don't get information. So as advocates, what you do, what you share, even what you create is so important because you just don't know the life that you're going to save. I wish we had started way back then measuring our outcomes, which we didn't, but that's okay because we know what we're doing is huge and big. And so if you're an advocate, anything that you do is not small, it's huge. Second thing I want to say is, please start where you are. If you have, I think Miss, and I'm just not keep mentioning you, Miss Marshall, but one thing she mentioned was Meals on Wheels. And do you know, sometimes in our city, we have Meals on Wheels, but there is a waiting list. So resources are awesome, but just because there's a resource out there doesn't always meet your need when you need your need met, right? So as advocates, we're gonna start where we are. We're gonna be strategic, we're gonna arrange some things. And so you may become the Meals on Wheels until the Meals on Wheels start. And that's what grassroots is about. It's not always measurable, but it's tangible. And when you take what you have and begin to do something with it, the magic happens. At Caregivers Respite, we started in 2010. Since then, we celebrated our 10th anniversary last year with our 15th Caregivers Rest Conference. We've done over 100 support group meetings. We have two main initiatives. One is we do the Caregiver Financial Summit. Well, actually, since it's on Zoom now, it's the Summit series. And it's to that stat that Ms. Marshall just shared again about the financial burden of caring. And it is so real. And the second initiative is around health literacy. I'm going to end, but I do want to say one other thing to advocates. You know, there is such a thing as health literacy. And so health literacy is not only knowing about and understanding about health and the terms, but actually knowing how to use those terms to better help your health, right? And so health literacy is always, with a capital A, an opportunity to help someone else. I don't care if a person has a doctorate degree, a master's degree, if they just got the diagnosis of cancer, they need some health literacy, right? And so it's always an opportunity to educate and to connect some of those vulnerable pieces that sometimes we just overlook. And it's always an opportunity for an advocate to connect on health literacy. We have so much work to do. So much work to do. So I just want to thank you for your time. Thank you.
Thank you, Ms. Janice Williams. That was so wonderfully said, all of it. I think you really helped light the fire in all of us as advocates as far as what we need to do. And I just love the approach that you talk about as far as starting grassroots, starting in your community. And, you know, that's again, why we, partly why we had conceptualized and are now carrying on our Caregivers Count campaign, because we do think it is a way for our patient advocates, our volunteers to have a role in supporting our caregivers. I often say that caregivers are the most passionate of our patient advocates. And so we need to do what we can to make sure that we care for them. I just wanted to give this plug that Ms. Janice Williams was also featured in our Advocates in Action podcast that we host at National Patient Advocate Foundation. She shares more about her story there and the work that she does. And we invite you all to check that out on the npaf.org website. We have our second season dedicated to caregivers. Our Ashley Freeman, my colleague, has interviewed a number of caregivers and they share their experiences. And so we invite you to have a listen when you have a chance. And now that we have gone through the presentations, I want to open it up to questions now. And let me see, as I bring up the chat box here, I really just want to actually pose a question for everyone. I think there was this really great just unifying theme in everything that you've, in what Karen, Janice, Chance, what you all discussed, and that's like that importance of those resources being available for caregivers, but knowing how to find that. And Janice, I think you've really described how what you've done to sort of solve that problem in your community. And Chance, I'm looking at you to see if you can share just, with the launch of the help desk, what has been the resource that has been the most popular for caregivers to just, say like, I want to learn more about this.
Yeah, absolutely. One of the things, and so we sort of monitor from a back end side, we're monitoring, different themes and questions that come in regularly. And one of the things that continues to be at the top of the list every week, every month, is that search for support groups. When we're family caregivers, we feel like we're on an island by ourselves, right? Like, our friends may not understand the scenario, our other family may not understand the scenario. And so really connecting with folks, whether that's an in-person group, whether that's a group through your church, whether that's an online Facebook group, connecting with others who are living that same or similar reality, it can be, immensely helpful. In a lot of ways. One, from, hearing and understanding and being able to talk openly with them, but also, they may be able to direct you to some local resource that's available, or they may be able to give you a tip or a piece of advice, or even help with respite care. We did a roundtable a week or so back with sickle cell disease caregivers, and they were saying that through support groups, they were able to find other family caregivers of loved ones with sickle cell disease who could, help them out in instances that they needed someone to help care for their loved ones, so they could, run errands or do other sort of respite care type tasks. And so, with some of these specialized diseases and conditions, there, is a unique sort of need and understanding that's required there. And so being able to connect with others who understand your circumstance is huge.
Thank you for that, Chance. And I'm looking at the questions now. I see one here. I think this is for Karen from Jessica Jones. I think it's specifically about the RAISE Act. Will the RAISE Act have a limit to the type of disease or caregiver?
So initially, the legislation that created it created the authority. I don't want to get too involved in how the statute was written, but it was written to give authority to do the work of the RAISE Council, to establish a council and carry out the activities that had formed it through Health and Human Services. And within Health and Human Services, the Administration for Community Living actually carries out and supports the work of the RAISE Council. Now, the programs that ACL administers largely focus on the aging population and older Americans, for instance, the National Family Caregiver Support Program that I mentioned earlier, and different programs that are funded by the Older Americans Act. That being said, the council has specifically acknowledged in multiple convenings over the past couple of years how all of these issues are relevant to caregivers across the lifespan, and we fully expect that as the report comes out and as the council works to develop a national strategy, that they will be looking at multiple, or at least have in mind, multiple caregiving populations across the lifespan. And meaning affecting different populations and conditions.
Thank you, Karen. And I see here another question. I think this may be directed to Ms. Williams. This is from Tony K. Mangscow, asks if there are links to the financial summit that you referenced.
Yes, in fact, I can send you the next, if you will go on www.caregiversrespite.org, and just give us your contact information. We'll send you the next link to the next summit series. We just completed 2 sessions back to back, and we're going to do 2 more at the end of the year. And I'll be happy to share that with you. But I will just say this, that about the Financial Summit series, we kind of have to, it's kind of like dual. Yes, we're coming to learn resources and strategies around the finances for our care recipient. But now it's really about the caregiver, because most things are kind of in place for the care recipient, but the caregiver, if we can start thinking outside the box about our own care, it will be a game changer.
And Janice, I was wondering if you can talk a little bit more about just some of the topics that you cover in the Financial Summit. I know you had mentioned before it used to be more focused on the care recipient, but now it's more of like that the financial health and well-being of the caregiver. Thinking through the stats that Karen shared about, just the upward, I guess the debt that most caregivers are experiencing as a result of their role. What types of things do you cover, and what is it that caregivers find the most helpful in your Financial Summit?
Well, you know what? I don't know if a certain thing is the number one thing, but when we talk about money, it affects everybody. As Miss Marshall said, we actually spend an average of $7,000 out of pocket when we care for someone. And that's already on top of us retiring early, cutting our hours. And if you think you have saved, sometimes you're just one thing away from things really affecting your pocketbook. So we talk about everything as far as, one thing that is popular is always learning the legal aspects of caring. Most people do not have their wills, their things, their wills, any kind of legal issue, they're not really intact all the time. And even when we do have them, there's other things that we can add to make our life easier. So when we hear about how Medicaid, people think they can, first of all, people still think that Medicare is going to take care of them in long-term care. And that is just so false. You either have to have retirement, Medicaid, you have to be in a armed service, a veteran, or private pay, or some type of long-term care insurance. That alone challenges people, because if you don't have that, then how are you going to get cared for? And so just learning what is not available can be a real eye-opener.
Thank you. Thank you so much for sharing that. I'm looking at the chat now. I see I see a lot of people are sharing just some of their own just personal experiences, and you're welcome to unmute yourself if you want to raise that here to discuss a finer point. I see there was a question posed around adult daycare. Does anyone have any knowledge or thoughts about adult daycare? Karen, Chance, or Janice, I'm not sure if you have any thoughts to weigh in there.
Well, what is the question about adult daycare?
I think whether or not just any sort of knowledge or thoughts about adult daycare. I'm not sure if it's in the context of COVID or not. Ella, I think you posed the question. You're welcome to unmute your line if you want to pose the question more specifically, if I'm not doing a good job in describing your question. Okay. Let's see.
I can hop in with a comment.
Oh, sure,
She's
sure.
not able to unmute for some reason. I'll actually convey an experience of with my dad. So the final illness that my father had was a dementia diagnosis, and I lived in the Washington D.C. area. He lived 4 hours away from me, and he wanted to age in place, but he didn't have any family nearby. And while we were researching different options to help him stay at home, we actually looked at the PACE program, which was offered in his state, which was Virginia, and several states across the country have PACE programs that provide adult daycare services, adult day services for family caregivers to provide respite during the day and help kind of bridge gaps if you're unable or don't have access to in-home health aides. And my answer is being relevant to the question. But in addition to providing that companionship during the day, through his Medicare benefits, because my father did not qualify for Medicaid at the time. He had access to transportation. While he was at the PACE program during the day, they would have been able to manage his medications for him, even package them up and send them home with them. We ultimately ended up not doing it because my father's condition just worsened very quickly, and we realized that aging in place wasn't an option. But for someone without Medicaid benefits, we actually found a PACE program, adult daycare services under his state's PACE program to be a good option if we had been able to do it.
I would also just jump in there. Sorry, I was having a little bit of audio trouble earlier. I would just jump in and say, yes, these are complex issues, and depending on your state and your municipality and the health systems, it's all going to be a little different. I wish there was a better answer for it than that, but our Caregiver Help Desk really is a valuable resource to help you understand what options may exist in your community, whether that's a large metro area or whether you're in a more rural area. Their degree of expertise is really vast. So I would encourage folks to use that as a starting point, whether they're trying to identify options for themselves or whether they're sort of navigating the nuances of it. I know that part of that question was tied to COVID-19. I would also point people towards our COVID-19 resource at caregiveraction.org. I'm going to throw the link in the chat here in a second, and it's a good starting point for understanding where are things on COVID-19 and where can I find related info.
And I would say, oh, I'm sorry.
Oh no, go ahead. Go ahead.
And I would say, it's so many things I could say about adult daycare, but in the world of COVID, yes, many of them did close. And so for a caregiver, you always have to have a backup plan. And I'm just saying that, have a backup plan, but it is not always easy to have a backup plan. But the world of COVID let us learn so many things. Adult daycare is like very important for someone who works and takes care of their loved one. And so they're able to feel safe that their loved one is being taken care of, that their loved one is in a safe place. They're not going to run away. They're going to be there when they get there. Somebody supervising them. They're eating a good meal. But if you couldn't get them there, then what really does that mean if you have to work? So, and we had several family caregivers that ran into that issue. And so backup plans are always necessary, and because we don't know what will be what. One of the daycares did open up that I know of. They opened up on a not as many people could go at once, and then their transportation was affected as well. So it's it can be complicated. But on the financial issue of adult daycare, I think there are many programs that will help pay like a stipend toward it. And but also the caregiver has to pay a stipend sometime as well. And so it is really something to think about.
Yes, thank you, everyone, for your comments there about adult daycare, and just also dropping the links to some of the resources that you all have available on your respective sites. And we will curate these links and share them with the larger group so you all have it in one place. We'll send that as a follow-up to you all. But looking at the time, I just want to say thank you to our lovely speakers today for connecting with us, sharing the work that you all are doing, and describing some of the ways in which patient advocates can be involved in supporting our family caregivers. So thank you all. And just before we close out, I just also want to point out that this is our week of action for this campaign, our Caregivers Count campaign, and we've listed actions that you all, as our grassroots base, as patient advocates, or just even caregivers, just something that you can do as part of this campaign this week. So the thing that we are excited about, where we're going to have a group of us kind of get together again to talk about caregiving, is our Twitter chat happening Thursday. So if you're on Twitter, we invite you to follow us and to join that chat by following the hashtag Caregivers Count chat. And that will be taking place at 3 p.m. Eastern. And again, just thank you to our speakers. You all have brought up some really great points about just why we need to support our family caregivers. And I saw that Rebecca Kirch also contributed to the chat that a lot of the points that you've made with regard to just caregivers not knowing how to navigate the situations, the experiences that they have with the financial hardships that come with being a caregiver. We at NPAF are working on our needs navigation platform, and that campaign will follow this one. And I think that's a good segue to that coming up later this year. So thank you all again to our speakers, to those who participated. We will follow up by email with more information. And I think, let me make sure, we have an evaluation that I think has been dropped in the chat too, but we'll circulate that in our follow-up to you all. Have a great rest of the day. Thank you, guys.
Thanks, Melissa. Thanks, everyone.
Thank you.